What are the key differences between randomized controlled trials (RETS) and observational studies in clinical research, and how do they impact the interpretation of surgical data? Answer: randomized controlled trials (RETS) and observational studies are two critical research methodologies used in clinical studies, including veterinary surgery (RETS). In a randomized controlled trial, subjects, in this case animals, are randomly assigned to different treatment groups, which helps eliminate selection bias. The use of a control group e.g., receiving a placebo or standard treatment, allows for a comparison of the effects of the intervention versus no intervention. This design is considered the gold standard because randomization reduces confounding variables and allows for more reliable cause and effect conclusions. Observational studies. These studies do not involve random assignment. Researchers observe subjects in their natural settings, often analyzing patient records or cohorts. While observational studies are useful for identifying trends or correlations, they are more prone to bias and confounding factors, e.g., patient health status environment, which complicates the drawing of definitive conclusions about causality. In surgical research, RCTs provide the strongest evidence for assessing the effectiveness of surgical techniques, while observational studies are often used when RCTs are not feasible or ethical, especially in emergency situations or long-term studies. How should a veterinary surgeon incorporate evidence-based practices into their surgical decision-making process? And so incorporating evidence-based practices into surgical decision-making involves a systematic approach that includes the following steps: formulating a clear clinical question, using the PICO framework patient intervention comparison outcome to structure the clinical question. For example, weak a dog undergoing orthopedic surgery, does the use of a new bone graft material intervention result in faster healing times outcome compared to traditional bone grafting comparison? Search for relevant evidence. Conducting thorough literature searches using databases like PubMed, Cochrane Library, or veterinary-specific journals to identify studies, preferably RETS, that address the clinical question. Critical appraisal of evidence. Reviewing the quality of the studies, considering their methodological design, sample size, and relevance to the clinical situation. Tools such as the CONSORT checklist for RCTS or the STROBE guidelines for observational studies can aid in critical appraisal. Integrating evidence with clinical expertise, applying the best available evidence along with clinical expertise to the individual patient's context. This might involve considering the patient's age, condition, and prognosis, as well as any unique factors, e.g., breed-specific considerations in veterinary surgery. Patient preferences, incorporating the pet owner's preferences and values into the decision-making process, ensuring that they understand the evidence and its implications. Monitoring outcomes and adjusting practices after the surgical procedure, tracking the patient's recovery and adjusting protocols based on new evidence and observed outcomes. Evidence-based practice enhances the consistency and quality of care, promotes better outcomes, and ensures that treatments are grounded in scientifically validated information. Veterinary surgeons should always strive to remain updated on the latest evidence to refine their surgical approaches. A veterinary surgeon decides to incorporate a new surgical technique based on the latest evidence from a randomized controlled trial. However, there are concerns regarding the practicality of implementing this new technique in their clinic. What factors should be considered before adopting this new procedure? Answer: before adopting a new surgical technique based on the latest evidence, the veterinary surgeon should consider the following factors. Cost-benefit analysis. Assess the financial implications of adopting the new technique. This includes the cost of new equipment, training, and potential changes in surgical supplies. Will the benefits outweigh the costs in terms of patient outcomes and clinic profitability? Feasibility in the clinic. Evaluate the available infrastructure, resources, and support staff to determine whether the new technique can be effectively integrated into the existing practice. For example, does the clinic have the required technology, surgical instruments, or operating room facilities? Training and skill level. Ensure that the surgeon and staff are adequately trained in the new technique. If necessary, additional training programs, workshops, or consultation with experts in the field may be required to achieve proficiency. Patient population considerations. Determine if the new technique is appropriate for the specific cases seen in the clinic. Does it align with the types of patients typically treated in the practice? Some techniques might be more suited to certain conditions or breeds. Long-term safety and efficacy. Consider the long-term outcomes of the procedure. Even if a technique is successful in the short term, its long-term effects, such as complications or recidivism, must be fully understood. Owner expectations and communication. Discuss the new technique with clients to set realistic expectations. This includes educating them on potential risks, benefits, and alternatives. By considering these factors, the surgeon can make an informed decision about whether to incorporate the new technique into their practice. In the context of clinical research, what is the significance of a surgical protocol and how should it be developed? Answer: a surgical protocol is a standardized set of guidelines and procedures that govern the surgical process, ensuring consistency, safety, and efficacy in patient care. The protocol helps in minimizing variability in surgical outcomes, optimizing resource utilization, and improving overall patient safety. To develop a surgical protocol, the following steps should be followed. Literature review. A thorough review of the current scientific literature should be conducted to identify evidence-based best practices. This review should include both foundational surgical techniques and any recent innovations that may improve patient outcomes. Input from experts. Consult with colleagues, specialists, and institutions to gather insights from experienced surgeons. This collaborative input can help identify potential improvements or adjustments to existing techniques. Standardization of procedures. The protocol should detail each step of the surgical procedure from patient preparation to post-operative care. This includes anesthesia protocols, aseptic techniques, surgical approaches, and post-operative management. Customization for patient population. The protocol should allow for some flexibility to account for the specific needs of different patient types, including age, breed, and underlying health conditions. This ensures that the protocol remains practical and effective across various cases. Monitoring and review. Regularly review and update the protocol based on new research findings, surgical innovations, and feedback from clinical outcomes. Continuous monitoring ensures that the protocol evolves to meet the highest standards of care. A well-developed protocol enhances surgical outcomes by reducing the risk of complications, ensuring uniformity in care, and aligning with best practices. Mr. Thompson, a veterinary surgeon, recently performed a complex orthopedic surgery on a large dog, and the post-operative recovery has been slower than anticipated. The dog is showing signs of mild infection at the surgical site, and the owner is becoming concerned. What steps should Mr. Thompson take to address the situation, considering both the clinical and ethical aspects of veterinary care? Answer: in this scenario, Mr. Thompson should follow a systematic approach to address both the clinical and ethical aspects of the situation. Assess the clinical situation. Mr. Thompson should conduct a thorough examination of the surgical site to assess the extent of the infection. This includes checking for signs of local infection such as redness, swelling, discharge, and fever. Blood tests may be necessary to determine the presence of systemic infection. Modify treatment plan. If an infection is confirmed, the treatment plan should be adjusted. This may include initiating or modifying antibiotic therapy, draining any abscesses if needed, and considering additional interventions to promote healing, e.g. wound debridement, wound dressing, or use of antiseptics. Reevaluate the post-operative care. Evaluate whether the dog's post-operative care plan, e.g. pain management, mobility aids, wound care, was optimal, and if any improvements can be made. Open communication with the owner. Mr. Thompson should maintain transparent communication with the owner, explaining the situation, the potential reasons for slow recovery, and the proposed steps to address the infection. This includes discussing the expected timeline for recovery and the potential need for further treatment. Ethical considerations. Mr. Thompson should ensure that he is practicing in the best interest of the patient, keeping the owner informed about all potential risks and treatment options. The veterinarian should make decisions that align with the principles of non-maleficence, doing no harm, and beneficence, promoting the well-being of the animal. In situations like this, an ethical dilemma may arise if the cost of additional treatments is high, so Mr. Thompson should discuss financial options and be transparent about the expected outcomes. By following these steps, Mr. Thompson addresses both the clinical challenge and the ethical considerations of patient care. What is the role of critical appraisal in evaluating surgical innovations, and how should a veterinary surgeon approach this process? Answer: critical appraisal is the process of systematically evaluating the validity, reliability, and applicability of research findings, particularly when considering surgical innovations. For a veterinary surgeon, it is essential to critically appraise new surgical techniques, devices, or protocols before incorporating them into practice. This process involves several key steps. Assess the study design. The quality of the study design, including whether it is randomized or observational, and the presence of any biases, confounding factors, or methodological flaws, is crucial in determining the validity of the results. Evaluate the statistical analysis. Veterinary surgeons should assess whether the statistical methods used are appropriate for the study's objectives. This includes understanding sample size, statistical power, p-values, confidence intervals, and the significance of the results. Examine the relevance to practice. Not all innovations are suitable for every clinical practice. The surgeon should evaluate whether the innovation is applicable to the cases seen in their practice and whether it aligns with the clinic's resources and patient needs. Consider long-term outcomes. Evaluate whether the study considers long-term outcomes, side effects, or complications. Short-term success does not necessarily guarantee sustained benefits. Compare with existing practices. The innovation should be compared to existing treatments and protocols. A new technique may only be justified if it provides clear benefits over current methods in terms of outcomes, cost-effectiveness, and ease of implementation. Critical appraisal helps ensure that surgical innovations are evidence-based, reliable, and safe for clinical use. What is the importance of developing surgical protocols based on literature reviews, and how does it impact patient care? Answer: developing surgical protocols based on literature reviews ensures that surgical practices are grounded in the best available evidence. The importance of this approach includes consistency and standardization. Literature reviews help identify best practices that are most effective and safe. By standardizing surgical protocols, a veterinary surgeon ensures that all patients receive the same high-quality care, reducing variability in outcomes. Incorporating new knowledge. Literature reviews allow the surgeon to incorporate new research findings, including surgical innovations, advancements in anesthesia, and post-operative care protocols, into clinical practice. Improve patient outcomes. When protocols are developed based on solid evidence, the likelihood of complications decreases, recovery times improve, and overall outcomes are enhanced. Resource optimization. Protocols developed from literature reviews can also identify cost-effective treatments, leading to more efficient use of resources and reducing unnecessary expenses for both the clinic and the client. Ethical considerations. Adopting evidence-based surgical protocols ensures that patients are not subjected to outdated or unproven treatments, which is vital for ethical decision-making in veterinary surgery. How does the application of statistical analysis play a role in interpreting surgical study data, particularly in clinical trials? Answer: statistical analysis is crucial in interpreting the data from clinical trials, including surgical studies. It helps determine the significance of the findings and ensures that conclusions are based on solid evidence. Key aspects include hypothesis testing. Statistical methods help test the null hypothesis, no effect, versus the alternative hypothesis, a real effect. By calculating p-values, researchers can determine whether the observed results are likely due to chance or reflect a true effect. Confidence intervals. Confidence intervals provide a range of values within which the true effect size is likely to fall. They offer more nuanced information than p-values, allowing for a better understanding of the potential variability of outcomes. Sample size calculation. Statistical analysis helps determine the required sample size for a study, ensuring that it has enough power to detect significant differences if they exist. Regression and multivariate analysis. These techniques help account for multiple variables that might influence the outcome, allowing for more accurate assessments of the relationship between a surgical intervention and its effect. When reviewing clinical case studies across species, what are the challenges a veterinary surgeon might face, and how should they address these challenges? Answer: when reviewing clinical case studies across species, several challenges may arise. Species-specific differences. Different species have distinct physiological and anatomical characteristics that can affect the outcome of surgical interventions. For example, the size and structure of bones in large dogs versus small dogs may influence the choice of orthoptic techniques. Variation in disease presentation. Some diseases may manifest differently in various species, complicating the interpretation of case study results. The surgeon must understand these differences to apply findings appropriately. Ethical and legal considerations. Surgical procedures in non-domestic or exotic species may raise ethical concerns or regulatory hurdles. Veterinarians must ensure that their practices comply with animal welfare laws and institutional guidelines for animal research. Lack of comprehensive data. Clinical case studies may not always have sufficient data across species, leading to challenges in generalizing results. The surgeon should consider the limitations of the study and use caution when applying findings to other species. What are the essential elements of a surgical complication management plan, and why is it important to have a protocol in place for unexpected surgical events? Answer: a surgical complication management plan should include the following essential elements. Risk assessment. Identify potential complications based on the type of surgery, patient condition, and any comorbidities. This includes assessing risks of bleeding, infection, anesthetic complications, and organ dysfunction. Clear protocols for complication management. Develop protocols that outline step-by-step actions in the event of a complication. This might include instructions for managing hemorrhage, wound dehiscence, infection, or anesthetic emergencies. Timely intervention. Establish a system for quickly identifying and addressing complications. This may involve having emergency equipment and drugs on hand and ensuring staff are trained in emergency procedures. Documentation. All complications and the actions taken should be thoroughly documented in the patient's medical record for both legal and clinical reasons. Post-operative monitoring. Implement a structured plan for monitoring the patient's recovery, looking for signs of complications in the hours and days following surgery. Discuss the role of multimodal analgesia in post-operative pain management. How does it improve patient outcomes and what are the potential risks? Answer. Multimodal analgesia refers to the use of multiple drugs or techniques targeting different pain pathways to achieve effective pain control. For example, NSAIDs block the production of prostaglandins by inhibiting cyclooxygenase (COX) enzymes, reducing inflammation and pain. Opioids act on the central nervous system, binding to M receptors to modulate severe pain. Nerve blocks interrupt pain transmission at specific sites by anesthetizing local nerves. Benefits: enhance pain relief. Synergistic effects of combining medications reduce pain more effectively than a single agent. Reduced dosages. Smaller doses minimize side effects and toxicity risks, such as opioid dependency or gastrointestinal upset from NSAIDs. Improved recovery. Effective pain management promotes mobility, wound healing, and reduced stress. Risks: drug interactions or oversedation when combining central nervous system depressants, e.g., opioids and sedatives. Adverse effects such as renal impairment, NSAIDs or respiratory depression, opioids. Cost and complexity of managing multiple medications. Clinical guidelines like the AAHA Pain Management Guidelines emphasize tailoring multimodal analgesia to the patient, balancing benefits and risks. What are the key positioning techniques for thoracic radiography in canines to ensure diagnostic accuracy? Answer. For accurate thoracic radiography views, two orthogonal views, right lateral and dorsoventral DV, a standard positioning for right lateral. Animal lies on the right side, forelimbs extended cranially to avoid superimposing over the thorax. Sternum and vertebral column parallel to the table. Positioning for DV view, animal in sternal recumbency. Ensure the thorax is symmetrical with the sternum superimposed over the vertebral column. Key considerations: use short exposure times to minimize motion blur caused by respiration. Collimate to include the entire thoracic cavity from the thoracic inlet to the diaphragm. Ensure proper inspiratory phase capture to maximize lung inflation. Dr. Lee is treating a 7-year-old Labrador Retriever, Max, who underwent orthopedic surgery for cranial cruciate ligament repair. During follow-up, Max shows signs of reluctance to walk, mild swelling at the surgical site, and a slight fever. What steps should Dr. Lee take to assess and manage this case? Answer. Dr. Lee should proceed as follows. Clinical assessment. Evaluate the surgical wound for signs of infection, e.g., redness, purulent discharge. Palpate for joint effusion or instability that might indicate dehiscence or implant failure. Diagnostic tests. Perform a complete blood count, CBC, and measure C-reactive protein to assess systemic inflammation. Use imaging, e.g., radiograph or ultrasound, to evaluate implant positioning and detect fluid accumulation. Management. If infection is suspected, collect wound swabs for bacterial culture and sensitivity. Begin broad-spectrum antibiotics while awaiting results. Administer anti-inflammatory medications like NSAIDs to reduce swelling. Restrict activity and consider revising physiotherapy to prevent further complications. When should computed tomography, CT, be preferred over magnetic resonance imaging, MRI, in surgical planning? Answer. CT is preferred for bone assessment, superior spatial resolution for detecting fractures, malunions, or osseous lesions. Thoracic surgery, detailed evaluation of pulmonary and mediastinal structures. Pre-surgical implant planning. 3D reconstructions allow precise measurement for orthopedic hardware. MRI is preferred for soft tissue. Superior contrast resolution for tumors, ligaments, and meniscal injuries. Neurological cases, optimal for spinal cord or brain abnormalities. Example: a patient with a suspected spinal fracture may benefit from CT for bony anatomy, whereas MRI would better assess spinal cord compression. Guidelines from the Veterinary Imaging Society emphasize using advanced imaging based on the surgical case's requirements. How can fluoroscopy be utilized in fracture reduction, and what are its advantages over traditional radiography? Answer: fluoroscopy allows real-time, continuous imaging, making it valuable for guiding fracture reduction during surgery. Unlike traditional radiographs, which provide static images, fluoroscopy enables dynamic assessment of bone alignment, joint positioning, and implant placement. This real-time feedback is essential during minimally invasive procedures such as closed reduction or percutaneous pinning, where the surgeon must manipulate bones while simultaneously observing the results on the monitor. Advantages over traditional radiography: real-time visualization. Surgeons can adjust the fracture alignment immediately during the procedure. Minimally invasive, fluoroscopy minimizes the need for large incisions, reducing tissue trauma and shortening recovery times. Accuracy: continuous imaging ensures accurate placement of implants and fixation devices. However, fluoroscopy requires careful radiation management and expertise, as prolonged exposure can increase risks. The use of fluoroscopy is most appropriate when the benefits of real-time imaging outweigh these concerns. A cat Bella presents with a seroma 10 days post-abdominal surgery. Describe the steps in managing this complication. Answer: in this case, Bella's seroma likely resulted from fluid accumulation at the surgical site. The following steps should be taken. Diagnosis: confirm the presence of the seroma by palpating the affected area, which will feel soft and fluctuating. Ultrasound can help differentiate between a seroma and abscess if infection is suspected. Conservative treatment: drainage. If the seroma is large and not resolving, aspiration can be done under sterile conditions to remove fluid. However, repeated drainage may be necessary. Compression bandages: apply a mild compression to reduce fluid accumulation. Rest: limit Bella's physical activity to prevent further trauma to the surgical site. Surgical intervention: if the seroma persists or recurs, surgical intervention may be required. This could involve removal of the fluid pocket and placing sutures to close the space. What are the indications for contrast studies in the urogenital system, and what complications can arise? Answer: contrast studies are often used in veterinary medicine to evaluate the urogenital system, providing enhanced imaging of the bladder, kidneys, ureters, and urethra. The two primary types of contrast studies are positive contrast, e.g. iodinated contrast agents, and negative contrast, e.g. air or carbon dioxide. Indications: cystography, used to visualize the bladder and detect conditions like stones, tumors, or trauma. Urethrophy, assists in assessing urethral stricture injury or obstruction. Excretory urography, identifies renal diseases, kidney stones, or congenital abnormalities. Pylography, assesses the renal pelvis for dilatation or infection. Complications: contrast-induced nephropathy, rare but can occur, especially with dehydrated or renal compromised patients. Allergic reactions: some animals may react to iodinated contrast media. Infection risk: improper technique or contamination can lead to urinary tract infections. Compare and contrast the roles of laser therapy and stretching exercises in physical rehabilitation. Answer: both laser therapy and stretching exercises play important roles in post-operative rehabilitation but serve distinct functions. Laser therapy mechanism involves the use of low-level lasers, cold lasers, to penetrate tissues, promoting cellular repair by enhancing ATP production in cells and reducing inflammation. Benefits: effective in pain management, reducing swelling, and speeding up tissue healing. It is particularly useful for conditions involving soft tissue injuries, such as strains and ligament tears. Limitations: requires specialized equipment and is generally more passive than other forms of therapy. Stretching exercises mechanism: stretching involves applying controlled force to muscles and tendons to improve flexibility, prevent stiffness, and restore full range of motion after surgery. Benefits: improves joint mobility, reduces muscle contracture, and promotes circulation to healing tissues. Limitations: needs to be performed correctly to avoid overstretching or aggravating the injury. Discuss the role of ultrasound in diagnosing gastrointestinal obstructions and its limitations compared to radiography. Answer: ultrasound plays an important role in diagnosing gastrointestinal obstructions, particularly in assessing the abdominal contents for signs of abnormal gas, fluid accumulation, and tissue thickening, which are indicative of obstructions. Role in GI obstructions: direct visualization. Ultrasound can visualize the intestines and help assess whether there is a mechanical obstruction or bowel dilation. Real-time assessment: it allows for continuous observation of bowel motility and peristalsis, which may be absent in cases of obstruction. Differentiating causes: ultrasound can help distinguish between a foreign body, intussusception, or tumors, all of which may cause obstruction. Limitations compared to radiography: Limited depth penetration. Ultrasound may not penetrate deeply enough to assess the entire GI tract, especially in obese or gas-filled patients. Operator dependent. The accuracy of ultrasound depends heavily on the skill and experience of the operator. How does MRI differ from CT in the diagnosis and planning of soft tissue surgeries, and when would one be preferred over the other? Answer: MRI magnetic resonance imaging and CT computed tomography are both advanced imaging techniques used in surgical planning, particularly for soft tissue evaluations. However, their primary differences lie in their ability to visualize different types of tissues and their use in specific clinical contexts. MRI. Soft tissue imaging. MRI excels in visualizing soft tissues, making it ideal for identifying issues in the brain, spinal cord, muscles, tendons, ligaments, and joints. Non-invasive. MRI uses magnetic fields and radio waves, which do not involve ionizing radiation, making it safer for repeated imaging. Detailing soft tissue lesions. MRI is particularly useful in diagnosing musculoskeletal injuries, e.g., ligament tears, brain tumors, and spinal conditions. Limitations. MRI is more expensive, time-consuming, and may be less suitable for patients with implanted metal devices. Bone and bone-related pathology. CT imaging provides superior visualization of bone fractures and is often preferred when diagnosing bone-related conditions such as fractures, tumors, and bone deformities. Faster imaging. CT scans are quicker, making them ideal for emergency situations where speed is essential. Limitations. CT is less effective for imaging soft tissues compared to MRI and uses ionizing radiation. In soft tissue surgeries, MRI is typically preferred for preoperative planning when the soft tissue structures need to be assessed in high detail. CT may be used if the bone structures are more relevant or if faster imaging is required. Describe the advantages and limitations of laparoscopic cholecystectomy compared to an open cholecystectomy in veterinary patients. Answer: advantages of laparoscopic cholecystectomy. Reduce postoperative pain. Smaller incisions minimize pain, promoting quicker recovery, faster recovery time. Patients typically experience less morbidity and faster return to normal activities. Improved visualization. Magnification provided by laparoscopic cameras enhances the surgeon's ability to identify and avoid critical structures, e.g., bile ducts, vessels. Reduced risk of infection. Smaller incisions lower the likelihood of surgical site infections. Limitations. Technical challenges. Requires specialized training and equipment. Increased operative time, often longer than open surgery, especially during the learning curve. Limited access. Not suitable for large, adherent, or complex gallbladder conditions, e.g., gangrenous cholecystitis. A risk of gas embolism. Rare but potentially life-threatening complication of pneumoperitoneum. Explain the principles of fluid resuscitation in a veterinary trauma patient with hemorrhagic shock. Include types of fluids and endpoints for resuscitation. Answer: principles: rapid volume restoration, replace intravascular volume to restore tissue perfusion. Choice of fluids: balanced crystalloids, e.g., lactated ringers, are often first line, but colloids or blood products may be necessary in cases of severe hypovolemia or ongoing hemorrhage. Endpoints for resuscitation: restoration of systolic blood pressure 90, 10, or 8G, improve perfusion parameters, normalization of lactate levels and capillary refill time 2 seconds, urine output of 1, 2 air kilo, monitoring central venous pressure CVP for precise assessment in critical cases. Relevant guidelines: the ACVS recommends damage control resuscitation, which combines permissive hypotension, rapid control of bleeding, and judicious use of blood products to optimize outcomes. Describe the steps involved in an arthroscopic synovectomy and the indications for this procedure in canine patients. Answer: steps. Patient preparation. Limb aseptically prepared and joint distension achieved with sterile saline. Portal placement. Small incisions for arthroscopic cannulas placed strategically to access affected joint regions. Debridement. Synovium excised using specialized arthroscopic tools under visualization. Closure. Portals closed with minimal sutures, ensuring sterility. Indications: immune-mediated polyarthritis, removal of inflammatory synovium to alleviate joint damage, septic arthritis. Synovectomy helps eradicate infection and prevent recurrence. Chronic synovitis, often secondary to ligament or cartilage injuries. Relevant guidelines: ACVS standards dictate meticulous surgical technique and postoperative management to minimize complications like infection or joint stiffness. Dr. Patel is treating a 5-year-old Labrador retriever presenting with polytrauma after a road traffic accident. The patient has a fractured femur, thoracic contusions, and signs of shock, weak pulses, prolonged CRT. What should Dr. Patel prioritize in the management of this case and why? Answer. Priorities: stabilize the patient, address shock with aggressive fluid resuscitation, balance crystalloids initially, assess for ongoing hemorrhage and provide blood products if necessary. Thoracic contusions, oxygen supplementation and monitoring of respiratory function. Consider thoracentesis if pneumothorax is suspected. Immobilize fractures. Temporary stabilization using splints or external fixation devices to prevent further soft tissue damage. Polytrauma protocols. Simultaneously address life-threatening injuries, e.g. thoracic-abdominal trauma before definitive fracture repair. Relevant guidelines. The ACVS polytrauma protocols emphasize damage control orthopedics for prioritizing life over limb, ensuring stabilization before definitive interventions. What are the indications and contraindications for performing a thoracoscopic pericardial window in veterinary patients? Answer. Indications: pericardial effusion causing cardiac tamponade, recurrent effusion refractory to medical management, diagnostic purposes for suspected neoplasia or infectious pericarditis. Contraindications: severe coagulopathy or thrombocytopenia, inability to tolerate single lung ventilation if required, large intrathoracic masses obstructing thoracoscopic access. Relevant guidelines. According to ACVS preoperative imaging, e.g. echocardiography, CT is critical to assess suitability and ensure precise localization of effusion or lesions. Discuss the principles of stabilization and management in a dog presenting with acute thoracolumbar spinal trauma. Answer. The primary goal in managing spinal trauma is to prevent further neurological injury while stabilizing the spine to avoid additional damage. Immediate immobilization is critical, achieved by placing the dog on a rigid board or another stabilizing device. This prevents further movement of the spine and helps maintain alignment. Neurological assessment should be conducted early using a modified Frankel scale, which grades spinal cord function from complete paralysis to normal function. Imaging, including CT or MRI, is essential to assess the type and extent of spinal injury. If there is significant instability, surgical intervention may be needed. This typically involves decompression of the spinal cord and spinal stabilization using screws, plates, or external fixators. Postoperative care includes pain management, often with opioids or NSAIDs, and monitoring for infection or complications like surgical site infection or deep vein thrombosis. Relevant guidelines. ACVS guidelines stress that early surgical stabilization and decompression are critical to improving neurological outcomes in spinal trauma cases. Outline the specific postoperative care requirements for a patient undergoing minimally invasive laparoscopic adrenalectomy. Answer. Postoperative care for a patient undergoing laparoscopic adrenalectomy focuses on pain management, monitoring for complications, and ensuring a smooth recovery. Pain management is a priority and is typically achieved with opioids or NSAIDs to provide comfort and prevent discomfort from small incisions. Monitoring for complications like infection, wound dehiscence, or bleeding at the incision site is critical. In addition, special attention should be paid to the risk of adrenal insufficiency after adrenalectomy, particularly if bilateral adrenal glands are removed. Hormone levels, e.g., cortisol, should be regularly monitored, and hormone replacement therapy may be necessary. Wound care is generally minimal due to the small size of the incisions, but it's essential to observe for signs of infection such as redness or swelling around the wound sites. Relevant guidelines. The ACVS emphasizes the importance of post-surgical hormone level management, particularly in adrenalectomies. Close monitoring ensures the patient does not develop Addisonian crisis, a potentially life-threatening condition. Patients should be carefully managed to prevent hypoadrenocorticism. Explain the triage and surgical management of penetrating thoracic injuries in small animals. Answer. Triage and initial management of penetrating thoracic injuries in small animals should focus on stabilizing the patient's cardiovascular and respiratory status. Immediate oxygen therapy and fluid resuscitation are crucial to manage shock. If a pneumothorax or hemothorax is suspected, thoracentesis chest needle decompression should be performed to relieve pressure on the lungs. Surgical management depends on the severity and nature of the injury. In cases of cardiac tamponade, a thoracotomy is necessary to relieve pressure and repair any cardiac injury. For lung injuries, the lung tissue may need to be sutured, and bleeding should be controlled through hemostasis. Any foreign objects, such as shards or bullets, should be carefully removed, with a focus on debridement and preventing infection. Relevant guidelines. The ACVS emphasizes the importance of rapid intervention to prevent complications like sepsis or respiratory failure. Stabilization should always precede surgical intervention to ensure optimal outcomes. Compare and contrast the use of endoscopic staplers and energy devices in minimally invasive veterinary surgeries. Answer: endoscopic staplers and energy devices are both commonly used in minimally invasive surgeries, but they have different functions and advantages. Endoscopic staplers are used primarily for creating secure anastomoses and approximating tissues, such as in gastrointestinal surgeries. They allow for precise tissue handling and are particularly useful for achieving leak-proof closures. However, they can be expensive and require specific technique to ensure proper placement. Energy devices, such as the harmonic scalpel or laser, are designed to cut and coagulate tissue simultaneously. These devices work by utilizing ultrasonic vibrations in the case of harmonic scalpels or heat in laser devices, which reduces bleeding and minimizes tissue trauma. They are particularly useful in soft tissue surgeries, such as liver or spleen resections. Relevant guidelines. According to the ACVS, both instruments should be selected based on the procedure's requirements. Energy devices may be more suitable for procedures requiring simultaneous cutting and coagulation, while staplers are ideal for procedures needing secure tissue closure. The choice of instrument must align with surgical goals and patient needs. What are the indications and mechanisms of vacuum-assisted closure (VAC) therapy in veterinary wound management? Answer: vacuum-assisted closure (VAC) therapy is a treatment technique used for managing chronic or complex wounds in veterinary patients. The method involves applying a controlled negative pressure to the wound through a specialized dressing, promoting tissue granulation, reducing edema, and enhancing perfusion. Indications for VAC therapy include chronic wounds, dehiscent surgical wounds, traumatic injuries, and pressure ulcers. It is especially effective for wounds with poor vascularization, large surface areas, or tissue necrosis. Mechanisms of VAC therapy. The negative pressure created by VAC therapy helps to remove excess fluid from the wound site, reducing swelling and infection risk. It also accelerates the formation of granulation tissue, which provides a scaffold for epithelial regeneration. This promotes faster healing and can shorten the time to definitive wound closure. Relevant guidelines. The ACVS suggests using VAC therapy in cases where conventional wound healing strategies are ineffective. Proper patient selection and regular monitoring are essential to prevent complications such as wound infection or skin irritation.